And so now, with no further ado, I will let Dr. Bonner kick it off.
Okay, here we are.
There we go.
Awesome. So my disclaimer is that I am doing mommy duty right now. So that is happening, but I am very happy to be here. 1 second. All righty. So I'm going to share my screen. And okay. Can everybody see those? Great. All right, here we go. Awesome. Well, I am super excited to be presenting today. As Stephen said, I was a part of READY, and Dr. Fisher was my mentor and a partner in this work. And so thank you for the invitation. And I apologize for any distractions that we might experience together here this afternoon. But I'm hopeful that this will be hopefully a fruitful conversation. So today I am presenting the work that I did when I was at READY, that was focused on using what we call an in loco parentis informed consent procedure to engage adolescent girls and young women in HIV research. So just for a bit of context, the work, I do a lot of work in South Africa related to sexual and reproductive health care for young women. And that is because South Africa has one of the highest incidence of HIV among young women, 15 to 24 in the world. And although, as many of you may know, there are a lot of research focused on this population to develop interventions such as PrEP for HIV prevention. You know, it's very difficult to engage young women. It's very difficult to engage young women in research related to this because of some of the ethical challenges of navigating South Africa law with kind of the ethical obligation to engage young women in research that is related to their healthcare. All right. So this is kind of a schematic of kind of the of some of the legal guidelines versus the ethical guidelines that we are presented with when working with young women around HIV and sexual reproductive health care in South Africa. So the South Africa National Health Act states that you can only conduct research with a minor if it is in the best interest of the minor, if it is done in such a manner that there are some conditions that are prescribed in the law, and for particularly relevant to this work, with the consent of the parent or guardian of the child. Also, if the minor is capable of understanding the consent process and also gives assent. However, the South African National Ethics Guidelines dictates that children who are 12 years or older can consent for sexual and reproductive healthcare services, and allows for a broader set of consent approaches. And so when we are going into communities and trying to work with young women, particularly around pretty vulnerable behaviors such as substance use and sexual risk behavior, we're really kind of threading the needle between these two sets of guidelines. And so what I'll describe today is kind of how we have attempted to thread that needle, and love to hear people's thoughts about that. So part of this journey, if you will, is that the law actually gives in the United States where the work is funded, allows for a parental or guardian permission, allows for a waiver of parental or guardian permission if it is not a reasonable requirement to protect subjects, and that there is an appropriate mechanism for protecting children who participate in research. So, I just want to call out, there are several factors here. So the work is funded by the United States, and this is the United States guidelines. It is conducted in South Africa, and so we have our IRB in South Africa, and then we have to abide by the laws in South Africa. So we're kind of trying to navigate three spaces. So I want to talk to you a little bit about the approach, which is called the in loco parentis, or in place of parent consent procedure. So this process really kind of evolved through community engagement around what the best ways would be to engage young women in research who are vulnerable to risk if it is found out kind of what they are engaging in. So for this particular study, the specific So what we did is sorry. So what we did is we collaborated with our community collaborative board to identify kind of how would we engage either an older trusted adult to consent in place of a young woman's parent, or allow for a community member to consent in place of their parent, and kind of what are some of the implications for that. And so what we came up with is young women can, in the study, could agree to participate if they could identify a young woman who was 25 or older, and kind of met some criteria around eligibility to consent for young women. And if they could not identify a woman who was 25 years or older, the community had kind of identified a community consent woman that could talk to the young woman and ensure that this maybe that she understood what was going on and kind of the implications for the research. They went through the consent process, and just kind of briefly, the young woman and the consenting adult were separated in a separate room. And so the young woman provided assent, the older woman provided consent, and that consent that was provided by the older woman lasted or was maintained throughout the study. So this was a study where we had a baseline, a 3-month, 6-month, and 12-month follow-up, but the older woman didn't have to come and consent every time. Once they did the one time, it maintained throughout the study, but the young woman was asked for her consent at each time point. So I just wanted to kind of give a little bit of a detail about how we implemented the process and what the experiences of the young women were. So this is just a snapshot. So we started this in 2013, where we at RTI engaged our IRB administrators, the South African Collaborative Board. We engaged stakeholders in 2014 and piloted the process. And then we had another study funded in 2016 where we really implemented it at full scale with 500 young women, 16 to 19. And then since the time of really full implementation, we have modified it actually based on some of the work that we did through the READY program to explicitly give young women the option to choose their mothers to give permission. And so we'll just talk a little bit about, and then we have another study that was funded shortly thereafter that's implementing this revised process. So I'll kind of skip through all of this. I'll provide it in I'll provide the slides later. But just to say that kind of we mapped the requirements of the kind of South African law and ethical guidelines onto the process. So for every kind of requirement of the ethical guidelines, we try to ensure that the in-loco parentis process mapped onto those requirements. And this is just kind of a schematic of the study. So we recruited 500 young women, used this in-loco parentis process, and then there was an intake and intervention and a 6 and 12 month follow-up. So as part of the READY process, we, this is kind of what, so I'll kind of skip through this. This is the randomized clinical trial. It was for those who were 16 to 19. And what we did for our READY project was to really kind of take those young women who were 16 or 17 years old at the time of enrollment. So they would have undergone the in-loco parentis process, but have kind of aged out, if you will. So now they're 18, they can independently consent. And we wanted to talk to those young women about kind of how they experienced the in-loco parentis process and kind of what insights they would have for us moving forward. So we did 4 focus groups with 31 young women. We did 2 focus groups with young women who were Afrikaans speaking and or identified as colored, and that had 18 young women in the group. And then we had another 2 groups with a total of 13 young women who were East Coast speaking or self-identified as Black Africans. All right, so I'll make this really quick. You can. So we recontacted people to see if they were interested in doing the focus groups, and then those who were interested were given 100 Rand or $10 US. So this is just kind of a schematic of how we. This is just a schematic of how we kind of identified our themes once we conducted the interviews. We actually kind of had a debriefing session with a subset of those who engaged in the focus group to elaborate on the preliminary themes. We did our transcriptions and then kind of did our inter-rater reliability with 2 independent coders, and then identified any emergent themes as in addition to our a priori themes. And so this is what we came up with. So this is, I won't read all of these, but it, suffice it to say that there were a variety of perspectives about who the women chose to be their representative. So some people said their sisters came, some people said their neighbor came, some people said their aunt signed for them. So there was very varied. Most young women said that from their perspective, trust and confidentiality were very much related to who they chose to serve as their representative. And that they felt like having that option really increased the integrity of the informed consent and assent process. When we asked kind of what the concerns would be if women had to have their parents sign for them, overwhelmingly, they cited privacy concerns, and that, you know, they were concerned about their ability to disclose information about the study with their parents. So they, like, when we asked them, like, what did you tell your parents, if anything, about the study? There were lots of variety about what people told their parents. But I think overall, they were grateful that they were able to regulate what they shared and what they did not share. So the conclusions that there are benefits to the in-loco parentis procedure. There was a variety in responses related to parental consent. Some people said they would still participate. Some people said they wouldn't. And some people most people cited confidentiality concerns. So they said, young women said they would share information about the study with their parents, but to varying degrees. And the very important maternal substitutes were aunts and sisters. So in conclusion, there's a lack of examples of kind of how this should be done and recommendations to follow the ethical consent of young women. And so we really hope that this serves as kind of a starting point for that conversation. Thank you.
Thank you so much. Yerina, so I was actually, sorry, before Yerina gets going, I just want to remind everybody in the audience, if you do have any questions, please do go ahead and chat those at any time directly to me. And now we will let Yerina take over.
All right. Well, thank you, everyone, and for being here this afternoon. I'm really excited to share some of my thoughts and my experiences on the ethical dilemmas in conducting research internationally. First of all, I'd like to acknowledge that I've been conducting research among female sex workers to understand their mobile use behavior to develop some kind of health intervention, especially around HIV and STI prevention. And this research has been funded through READY. And, you know, I have been working with Dr. Kaveh Koshnud and Dr. Celia Fisher as my mentors on this project. And so instead of talking about the project itself today, I'm going to be talking about some of my experiences in terms of the ethical dilemmas I have experienced. So just a little background about myself. You know, I got my PhD in communication, so I have that interest in communication. How do we use communication tools to improve health, especially in developing countries, including where I originally am from, Nepal. And so I have a little bit of HIV background as I did my postdoc at AIDS Center. And currently I am an assistant professor of communication here at University of Missouri. So talking a little bit about some of the projects I have been involved in, I've been a part of projects where we have developed mobile health or mHealth interventions to look at various health outcomes among people with HIV, to examine their adherence level. And currently with the READY project that I'm working on is to understand how sex workers, specifically female sex workers, use mobile phones with the intention to design mHealth intervention, like I said before, for this population in Nepal. So for this project, I have you know, visited, or I have, visited the research site twice in the past year. And I've also collected some formative data in Nepal during COVID-19. So what I'm going to be talking about today are, you know, collectively the experience of being in Nepal. Even though I'm a native of Nepal, I've been living in the States for the past almost past 20 years. So I'm kind of, you know, reorienting myself to the culture, and I would still consider myself, you know, acquainted to the culture, but also it's sort of in between, right? So whenever I'm traveling to Nepal, I experience counter-cultural shock, I would say. So from that perspective, I am, you know, I'm presenting the information today from that perspective. So a little bit of background about Nepal. It is a very tiny country in South Asia, squished in between India and China. It's one of the least developed countries in South Asia. And talking about the population of interest, there are more than 50, and this is, you know, only, this is recorded. There are probably more you know, sex workers in the city, but this was recorded in 2017, more than 50,000 sex workers, and they are affected, or they experience HIV disproportionately. And there's a high level of stigma and discrimination associated with being in sex work around HIV. And so these are demonstrated through discrimination and violence. And women experience poverty, they have low literacy levels, and they're mostly internally migrated from rural parts of Nepal. And so they are, in a resource poor setting, they are a population that have very little access to resources and other support. So in this background, I've been going to Nepal and collecting data, and some of the issues that I've been kind of thinking about are this is a very vulnerable population, a marginalized population, and I, as a researcher, when I travel from a university at an international location, even though I am a native of Nepal, I'm not really working day in and day out, and I'm not really acquainted in the community. So there's a sense of distance between participants and a person who's collecting data with them, a new face. So it feels like the ethical issue here is the distance that is created because you're not in that location, and because you are going there as a person, just to, feels very extractive. So so that's one thing that I've experienced, and there's also a lot of cultural nuances within that context of Nepal that even though being a native from Nepal, it's sometimes difficult to grasp because the standards and the cultural understanding that we have here in the United States, or if you're in a different international location, is going to be different. So an example is there's still a lot of caste and class-based discrimination that is very obvious between the communities in Nepal. So one example that I can share is my research assistant, one of the research assistants that I had hired, expressed some discomfort being around people who were transgendered, and cited that the person who from the transgender community was from a different caste than her. So this was just in a casual conversation, but it was very obvious that this kind of training was lacking, or this kind of discrimination, conversations came up because there's still a lot of bias in this, in the general psyche in the society in Nepal. Also, when we talk about privacy, the way we view privacy here in the United States, we're very concerned about our private information. We are, specifically when we're using our mobile phones, we're concerned about our data. We're concerned about what information we share about ourselves. We're conscious about the information, the medical information that we share. So there are laws that protect that our private information, versus in a place like Nepal, the way we view privacy is very different. So one of the things that I wanted to ensure when I was interviewing sex workers in the office of the NGO that I was interviewing these women, they, even though I interviewed women in private offices, they would, gather outside of the office, chit chat among themselves, share information about each other, which it was very hard for us to maintain that level of privacy, because once we spread the information about the study in the community, people came in groups, right? Friends, people who were sex workers who were in that network, collected in groups and came to the office, and they just hung out. And it was, it was very difficult to say that, no, we don't want to disclose your sex work identity, because they had gotten to know each other, they had shared information. So the concept of privacy and the way we see it here is different from the way it was perceived, or it is perceived there. And so some of the some of the rules and regulations and some of the things that we say is very important for us to follow could be difficult in a setting like that. The point about unequal partners is when I, as a researcher, go into the field with, to interview sex workers on the street, there's a level of difference in terms of, the power imbalance, right? Just by the nonverbal and the verbal communication. For example, the clothes that I'm wearing, the kinds of, gadgets that I have. For example, I take a tablet to do a survey and things like that. It gives a sense of power difference just by how I appear and how I speak. So these are things that I have been thinking about in terms of how do we become equal partners, right? And I don't have answers to these questions. These are just things that I've been thinking about and raising in my mind, and hopefully we can have some discussion around it today. And then the burden on participants. When I was doing my research during COVID-19, a lot of women, a lot of participants in my study started approaching me directly and the research assistant for basic necessities such as food and medicine and things like that. And the research project and the research funds that I had received, I was not allowed to repurpose that funds for a different purpose versus just using that as a financial incentive for participating in the research. So the needs between my need as a research as a researcher versus my participants' needs were completely different. And this put me in a lot of dilemma as to am I doing the right thing here? Am I being really selfish and just extractive? And how can I address or how can I help the research assistants? The participants in the study, right? And so I ended up setting up a GoFundMe account, and I collected some money, which is not a lot of money, but I was able to collect some funds to send it over, and my research assistant was able to buy some basic stuff for the participants. But because sex work was almost non-existent during COVID time, and all of these participants were really suffering. So it was a really difficult time, and for me to be collecting data about their mobile use behavior, where their needs were completely different and their needs were at the very basic level. And finally, I want to talk about this idea of moral distress. So I have some pictures here of, the places that I visited in Kathmandu, where these women worked. And these are just sites, but I just want to say that there were sounds and there were smells and things that that was extremely overwhelming for a researcher who has traveled internationally to go directly and conduct some interviews. So again, coming back to the issue of my needs versus my participants' needs, right? So I experienced this a lot, and I truly believe that every human has the right to access to basic needs such as food and clean drinking water and sanitation and legal rights, and to be able to be free from violence and harassment. But these are the basic requirements of any human being, and that's what I as an individual believe in. And when you're in locations like this, you understand what their needs are versus you go in with your need, collecting data for your project, right? So this sense of shame and self-blame comes over. And so it's something that, we don't talk a lot about and we don't hear a lot, but I think this is something, it's not just by nurses or doctors who work in resource poor settings, but also researchers. And so this is a question to myself and a point for discussion as to how do we address this? How do we balance the needs for our participants versus the needs of our funders? So with that, I am going to pause my presentation and open the floor for discussion and questions.
And so I want to go ahead and actually start with a question from the audience that I think is a great question for both of you. And so the question is, I understand that your research subjects come from a marginalized group, which can present challenges in building trust. However, I'm impressed by your ability to establish, some sort of a positive relationship with them. And I was wondering if you could share some effective strategies for building trust with these communities. Additionally, I am curious about how important is trust to the success of your research and whether the research would be as productive without it. So thank you.
That's a really great question. So some of the strategies that I have used to build trust is some of the things that I got my degree in social work, and that has come very handy in this process. So I speak different dialects and different languages that are spoken in Nepal. So I try to match my language to the language of my participant. That's like one very basic thing that I try to be relatable to them. That's one strategy that I have used, which has been successful. The other strategy is also that it's very, very important that they understand why you're there, right? So what is the purpose of your research and what are they going to get out of it? And are they going to be harmed? All of these questions are very important. So one of the things that I learned through READY was really making sure that your informed consent is very, very clear. And so the participants in my study come from low literacy level and therefore are not able to read informed consent. And sometimes, even when we speak the language, the Nepali language, even if it's the same language, the standard in which things are written and verbalized could be very, very different, right? So bringing down or bringing the language down to the level of their understanding, using the slangs that they use in their everyday language in the informed consent. And also I created a video format which they could watch and ask any questions. So really showing compassion and being there to answer any questions during that informed consent time, really taking time. If they want to start the conversation about, how their day was and just, talk about anything besides the questions that I have, I make myself available for that process so that they start feeling comfortable. A lot of the participants in my study had never talked to anybody about their experiences, never talked to their experience about violence, never talked to their experience about their experience being a sex worker. And so just asking those questions were extremely cathartic for them. And so allowing them to talk through their troubles before I started asking the research question, that I felt was very, very helpful in building trust.
Courtney. Yeah.
Yeah, that's hard to follow, and wonderful presentation. Thank you for that. So I would echo a lot of what's been said, and then I would also add, I think, for me and my project in particular, I was the beneficiary of a long-standing relationship with the community that the principal investigator of the study that I was working on had already established. So I want to honor that because Wendy has been working in South Africa for over 25 years, and only through those organic and long-standing and strong relationships was I able to do the work that I was able to do and present. And I think it speaks to how long it takes to build trust, and doesn't always take 25 years, right? But I think the point is it takes relationships to engender trust, and relationships often take time. And so I have learned that in my own work since this study, working in Atlanta. I do a lot of work in Atlanta now, and I've been in Atlanta 4 years. And I feel like I'm just now starting to really engender trust of folks here who are leading community-based organizations. And so for me, that's key. The relationships are key even before the research starts, so that when there is an opportunity to answer a question, that you can go to those partners, those people who you have a relationship with, and ask them, here's an opportunity. What questions would you like to know the answer to? Or what problems would you like to solve? And let's leverage this opportunity and this funding to answer that question or to solve that problem together. And that's been really helpful for
me. Yeah, thank you for that. And Yerina, I was wondering if, following up on what Courtney just said, can you say a little bit more about like the organizations that you're working with over there, or those sorts of things that you're doing over there as well?
Yeah, so as Courtney said, I have also been fortunate to partner with a non-governmental organization in Kathmandu, which has been working with sex workers for the past 30 years. So that has been a really great help. So the research assistant who worked with me has also been a program officer and knows a lot of the women in the community and has been, working with them for a long time. So if it was just me going there and exploring and trying to talk to somebody and building that relationship, that I think would not have been possible, I would say. So it was great help that I was able to identify an NGO that has been in the community for a long time and that the community members trusts. And therefore they kind of, extended that trust to me as well.
Great, thank you. So one question I had for Courtney here is about some of the cultural norms that were going on in terms of your particular study, and thinking about trying to navigate, how do parents feel about these sorts of issues, both in terms of like the issues that you're studying, but then also the issues of, allowing their children to participate in these sorts of things. And so one question from the audience, related to this is, did you hear about any of the parents protesting these things, or, any blowback from that, or other things related to that side of the equation?
It's an excellent question. It's something that I thought a lot about when we were writing this paper, like really, how do we frame this in a way that if a parent was reading this, like they could understand, right? And maybe not agree, but also kind of have an empathetic approach to kind of what we were navigating and why. So to answer the question about did we get any blowback from parents? No, not yet. the paper's been out a couple of years. So like there was a moment where I was holding my breath, like, this is going to be on the BBC, but that hasn't happened. And I also think in terms of like how parents are feeling about these particular issues, like we know from previous research that there are parents who would, minimally shame their child around issues of sexual activity. At worst, put them out of the home. These women that we were engaging with also were engaged in some substance use, and some were engaged in some pretty, I would say, like significant substance use around methamphetamine, and there's a drug in South Africa called Mandrax that's kind of like methaqualude that's smoked kind of through a pipe. So there are lots of very stigmatized activities that were going on with the women that we were engaging with. And had their parents known that they were engaging in these activities and or engaging in research, and then kind of de facto found out what the research was about, kind of putting the pieces together, it could have had significant risk for our young ladies. And they told us that in the focus group, like, no, I did not. I told my parents I was in a health study, right? Or I told my parents that I was in an alcohol study, right? Like, so it's okay, about alcohol, but not like I was doing methamphetamine, right? So like there are all these very nuanced ways that young women were talking about the study to their parents. And we know that that's because they understand the risk, right, of that being made known to their parents.
And a couple of quick follow-ups related to that. So one follow-up is about, so you had mentioned in your presentation that there are already these norms in place where girls of a certain age, you said 12, right, are allowed to seek medical care, without consent. And I'm sort of curious, without parental consent. And so I'm sort of curious if you think that those norms helped facilitate or justify perhaps thinking about research in these same sort of ways as well.
Yes, it actually was one of the major kind of tenets of our approach, right, is to say, in our study in particular, we were promoting HIV testing and kind of the integration of HIV testing and linkage to care with other social services. And so one of the points that we make is oftentimes young people engage in research for the benefit of healthcare outside of their community, right? So although a 12-year-old could go into their local clinic and get tested for HIV without parental consent, we know that because that clinic is in their community, it's likely that their parents will find out that they went, or that there could be talk of them going, and that sometimes they really would rather get those services elsewhere, right? And so oftentimes research is that elsewhere. And if they can get these services in their clinic at 12, well, why can't we provide them as part of research without parental consent? So that was a really strong basis for our approach.
And one final follow-up related to the thing that you had said previously. So given that, these girls had a good understanding of the kinds of things that they might be subjected to if they sought their parents' consent, or if they informed their parents of what was going on there. I was also just wondering, were there any people of those relevant ages in the community advisory board, or that sort of decision-making organization?
People who were youth, or people who were parent?
So youth.
Youth. Yes. So yes, we have a youth advisory board. Yeah, and so they kind of echo what we were, thinking and hearing, and kind of validated a lot of our thoughts. Mm-hmm.
So one question here from the audience for both of you is, thinking about coordinating these things in the US and international. And so one question here is, was it, I can imagine it was difficult to coordinate funding from the United States with international IRBs, with research that adheres to international laws. If possible, could you go into a little bit more detail how researchers accomplish this level of coordination, or how to overcome obstacles that come with so many different moving parts?
I could go first. For me, it wasn't so much of a challenge versus just the number of steps that I had to take. And it was, of course, more elaborate than doing research here. But the research community, the health research community in Kathmandu is pretty well established. It was just figuring out, the process that, just figuring out the process and just, I guess, following it, I think is more time consuming. But besides that, I didn't face any particular challenge. So, if you're thinking of doing international research, I think the research and doing research takes time and establishing and, making sure that you're following all the steps. It's just a matter of time. So that's my take on it. And I see a question from Celia as well, which I'm going to address after Courtney takes a stab at this question.
Yeah, thank you. I was gonna really echo your point. I think the other thing I will add, and it goes back to the relationships piece, is understanding the process. And oftentimes it's helpful to have someone who's gone through the process or who is familiar with the process in that country to help you understand the process. Similarly, South Africa has a pretty robust research infrastructure. And because we have a relationship with like the South African Medical Research Council, and some other kind of research institutes in South Africa, it was very, I won't say easy, but the process of doing research is set out. It's clear. And so as long as we abide by that process, we're fine. I will say for our particular trying to develop this procedure, I think was probably challenging in terms of not wanting to try to apply a US standard to the South African context. And so I think that in that way, it was very important to understand what the laws state and then what autonomy and degrees of freedom we had from the ethical perspective, because like I said, the ethical guidelines are somewhat different than the legal guidelines. And there's a whole body of work that talks about the gap. And so having those relationships in our community collaborative board, as I'm told, because I wasn't in the thick of the development, but as I'm told, was very integral and very important for being able to navigate that gap.
Thank you. So now I would like both of you to address this question from Celia, and so I'll go ahead and read it so that everyone here's it. So Yerina, you so beautifully discussed the experience you had as someone who is from Nepal, but also from America. In some sense, experienced what Du Bois coined dual consciousness. I was wondering if you could talk about this more, about how this affected you and your work. Similarly, Courtney, I was wondering if you had any similar emotional reactions to different ways of identifying with the participants you are working with in your research in Atlanta.
So for me, this is the first time I have gotten to really interact directly with my participants, even though I have done a lot of literature search and all of the reviews and things like that. First time ever in contact, in person, interacting with the participants and just going to the sites and going to where they live and they work. And I have to admit that I'd never seen the site of Kathmandu before. It was shocking to me. It was very disturbing. And of course, you know, it made me think of all of the privileges that I have had as, you know, as an individual living in the United States. And also it made me realize there are a lot of things that are, you know, pretty standard in the States, which is not the case. You know, it's different culturally. These are different places. These are different, you know, places, and the way people communicate with each other, the way people, you know, view things are completely different, even by, you know, some basic ethical standards. Again, caste system is very, very ingrained in the society, and a lot of the participants, a lot of the sex workers were from the lowest caste, and that's something that, you know, still exists in Nepal, caste-based discrimination, and it was very evident through this experience for me as to how caste, this kind of discrimination manifests, right in people's opportunities. And so as a person, it has affected me a lot. It has been a really great experience, learning experience, but at the same time, it has also taken some emotional toll on me as a person. As a researcher, I also think that there's a lot of work to be done in educating and building some basic research infrastructure in Kathmandu around this topic and around this population. There's a lot of work that needs to be done in educating the basic, you know, education in research and ethics. And so I feel that, you know, I have a long way to go.
I so appreciate that, Yerina. For me, that's actually really interesting. The question about women in Atlanta, or kind of identifying and working with women in Atlanta. So kind of the work that I do, particularly with Black women in Atlanta, is centered around integrating PrEP for HIV prevention into usual healthcare settings, particularly OBGYN settings and primary care settings. And I actually started on this journey because I identify as a cisgender Black woman. And I went to, I was as Celia and maybe some other ready folks may remember, I was very pregnant during, right before COVID. And I was going to the OBGYN a lot. And I went to, I was being seen at this practice that served mostly women of color, mostly Black women, and that was located in a predominantly Black county in the Atlanta metro area. So the Atlanta metro area is kind of roughly made up of about 4 or 5 counties, 2 of the largest ones being Fulton and DeKalb. And so, and both of Fulton and DeKalb are my majority African-American. And so pretty large practice. And so they had 3 offices, and one day I went into one office and I just asked, you know, do you all provide PrEP? And they said, no, we don't do that. And there was like no follow-up conversation. There was no referral. There was nothing. It was like, we don't do that. I said, okay. So I went to the other 2 and it was the same response. No, we don't do that. And I thought, you know, like, what a missed opportunity. And, you know, if I'm pregnant, like I'm a pregnant woman, I'm asking for an HIV prevention medication, I feel like I would be like the prime candidate for somebody to engage, right? And so the response to me is, no, we don't do that. The response to everybody is, no, we don't do that, right? There's nothing about, I have insurance, it's reimbursable. Like there's nothing about my presentation that would say that I like would not be a good candidate for PrEP. And so when I kind of surveyed women in the area via some focus groups. People were having the same experience. Either they didn't know anything about PrEP at all, or they were not at all familiar with where they could get it if they were interested. And so for me, it's funny, I don't really have the dual consciousness problem, because it's like literally I feel like I'm studying me. So that's kind of my emotional, very like non-objective impetus for this work that I'm doing in Atlanta. So I always, every time I actually do my presentation, I start with that, because I like want to lay my cards on the table, right? That this really is kind of me search. So we can talk about the ethical implications of that, but.
Yeah, so I have a question that's sort of a follow-up to something that Courtney said, but I want to give both of you a chance to talk about this. And this was the comment about make sure that we're not applying U.S. norms to the South African context, right? So one perennial concern in research ethics is sometimes, maybe this is more in biomedical research, but there is a concern about taking advantage of lower standards that might be present in different countries. And so how might you think through these issues of cultural sensitivity to make sure that you're upholding rigorous ethical standards while not imposing your own values in a context where it's inappropriate to do so?
Do you want me to go first, or?
I was just thinking, I was like, that's a really good question.
It is a really good question.
No, that is a really good question. I almost feel like in some regards, the South African standards are higher because of the appreciation for the risk of that, right? They have a very healthy appreciation for neocolonialism and colonialism, and and extractive research, and exploration. I think they probably have a better understanding of that than the United States, because the United States doesn't have that history necessarily. And so there are guards, and I'm speaking specifically for South Africa. I feel like there are guards in place to guard against that. And I think that manifests as higher standards for engaging people in research, is particularly young people. So I'll think about if the reverse were true, but I'm having to do a little bit of mental gymnastics.
The example that I could think of was that of privacy, which I already shared. And again, I was conducting interviews in locations where the possibility of providing privacy was very difficult. We tried and we did it, but there was one place where I actually went to the community. It was a house of a single woman who she had offered this place, and the entire community, the children around, and this was a slum area. We did get a private room, but the children, the animals in the slum area, the men who were just sitting around, everybody started becoming very curious, and they were like, hovering around the house, and started to gather outside of the house, of the door. And so it was very difficult to maintain that privacy. And when I was having a conversation with a research assistant, she just pointed out that, yes, some of the standards that you follow in the States, especially with people who have HIV or, who are at high risk population, is just not possible just because of the logistics of arranging everything and just the resources that we have here. So Yes, and again, the concept of privacy is perceived completely differently in that culture versus here. So that's, that's something that I would like to say, that not necessarily lower the standards, but just a different standard.
Can you both speak a little bit about that relationship between you and other research staff that's on the ground in these places? So both in terms of how do you make sure that you are all on the same page in terms of how things are going and the standards that are used that are being used and implemented, but then also it sounds like there's potential for two-way communication and learning on in both directions. So I was wondering if you could both speak to that a little bit.
Yeah, I can speak to that. So again, I'll defer to Wendy, who has really laid the foundation for a very strong research infrastructure in South Africa. And so there is always a research staff and then also kind of a research manager that is kind of the liaison between the research staff and the team back in the US. Before COVID, there were lots of trips back and forth, right? And from this particular project, to kind of understand the local forensics process, I was in constant communication with the manager in South Africa, and she really led the charge of recruiting the young women and kind of setting everything up. And then I flew to South Africa to do the focus groups, and really learned more than I ever thought I would from the staff that had already been there recruiting women, identifying the women. And so there definitely is two-way communication. Two-way learnings, I would say. In my case, it might have been more one way with me learning more. They already know how to do this. That's kind of what they do. But the one thing I do want to say about kind of capacity building around staff internationally, I think sometimes when people do international research, there is a tendency to kind of develop these relationships, hopefully, symbiotic relationships, develop a relationship with the organization, kind of hire staff in that organization. And then when the grant is over, then, you move on to the next thing. And what I really have valued about working with Wendy and our team at RTI is that we really do make every effort to continue to hire and keep our staff, and then promote them. So if they were a data collector on one study, maybe they're the manager in the next study. And it's been wonderful to see how people progress through the studies and kind of develop professionally on our international teams. And then when we're not able to do that all the time, there's a huge concerted effort to place them in different research centers. So because South Africa has a pretty robust research infrastructure, there are oftentimes opportunities in other agencies for data collectors or data analysts or research managers, and they've gotten that experience. And for better or worse, from a US company, right? And so being able to write that recommendation and make those connections, I think has been a wonderful thing to see.
Yeah, I think you put it wonderfully, how it's, we're constantly learning from the research staff there, because they're the ones who are, living there, and they're the ones who've been there for much, much longer than I have. So it was the same. I had started, my conversation with this particular NGO since 2017 when I was interested in this population, and I was applying for grants and things like that. So we had been in continuous conversation, and finally I got to meet them in 2022 in person. So we had already established some kind of relationship before that, and and in Nepal, the relationship professional relationship and kind of personal relationship kind of dilute as the culture. So you get invited to like their family dinners, and you eat lunches together, and you so interact socially as well. And so you kind of build that relationship with those kinds of, like Courtney said, it takes time, it takes years to build that relationship, even with the staff that you're working with. So it's been the same for me as well. And in terms of communication, so I had to really understand, again, reorient myself to the Nepali culture. I realized very quickly that people don't respond to emails. They call on your WhatsApp or Viber, like if they have a question. There's no, emails are very, very formal, and people don't use emails as much. And things like that, I had to pick up very quickly. And mainly important is maintaining that communication, having frequent meetings, updating, getting updates from them, and also touching base. Just sometimes, they would just, one of my research assistants would just pick up the phone. Hey, I just wanted to say hello. Like, we had built that kind of relationship, and I feel that I can count on them right now. And so it has taken time. It's taken years. So.
So for Yerina, I've got one question that has to do with the GoFundMe and providing some of the basic needs for some of the participants. So this question is about, like, would you get pushback potentially from like a US IRB about that potentially being seen as a coercive benefit, something like that? And then in addition to that, I was also sort of curious how this might, connect up to that concern about the helicopter research. And so, when the research project is done, if that sort of support isn't being provided anymore, could there potentially be issues related to that?
Yeah, I've been thinking of establishing my own NGO. Yeah, but going back to that question of doing a GoFundMe, I haven't, it was a completely separate, although I understand the perception of, and the looks of being coercive. At that point in time, it was an immediate emotional response, I would say. There were calls from participants to the research assistants there, like continuous calls. We don't have food. My children haven't eaten food in the past how many ever days. So these are the kinds of calls, and they were desperate. And so it was an immediate, visceral, sort of an emotional reaction to how can I help. And in terms of, helicopter researching, I'm a parent, so that's the first thing that comes to my mind. But yeah, I think it's a great question. And I think once you start working with participants, start getting, involved, it does seem like, it's your responsibility to continue some form of research going on so that you can support your research staff. And I haven't found an answer to that. How do we do this? And I'm at an institution where applying for grants is not required, actually, not necessary to be tenured. And so, this is something that I'm doing because I'm really interested in doing this kind of work. And so, my motivation of continuing to do that also comes from, I would say personal investment in this community now. So I don't have an answer of how we can, turn one project to another to, besides continuously applying for grants. Yeah.
I mean, and I think that speaks to one of the pervasive challenges of research in any context is, yeah, how do you keep this going? How do you continue doing the work that you think is incredibly important? And that connecting it back up to that first question about trust, right? Making sure that not only is that trust maintained, but it is respected and it is not violated if there starts to be these concerns about expectations and things like that. So I just want to say, to the audience, if they're, please do, if there's any more questions that you have, please do include them in the chat. But I guess just a general question for both of you. So we, have some young researchers who are in the audience today. And what advice might you give to someone who is thinking about, their research future and the kinds of projects that they're choosing and how they're going about their research? Do you have any general advice for them?
This is one of my favorite questions to answer. I would say if you're interested, if you want to do research and the question is kind of what kind of research, I think the only way to answer that question is to be exposed to research. And so, just trying things out, really taking advantage of time and youth, and programs and opportunities to just try things on and see how they fit. So, if you think you're really interested in international research, just kind of try to seek out those opportunities, talk to people who are doing the work, volunteer if you can, because I think the only way to know what makes your heart smile is to kind of strike it like gold. And I think once you find it, really follow that. And so, I am employed in an institute that requires me to apply for funding. And I'm like, Yerina, what is that like? That's so nice. But I don't see it as a burden because I really am very discerning about what funding I apply for, because I know it makes me get up in the morning and what gets me going. And if it's not centered on that, then, I respectfully pass it on to a colleague, or maybe I partner on that project, but don't lead it. And one example of that is, my passion is around, Black women and sexual reproductive health care, and Black broadly, of African descent in the diaspora. And I was working on a proposal in January around providing PrEP for cisgender Black women, and decided to maybe move in a different direction. And so I reached out to a program officer for another announcement, and I said, "Hey, I see this is, I see there's an announcement for this grant, and I see it's focused on populations who are disproportionately affected by HIV, but there's really no call out for cisgender Black women who are disproportionately affected by HIV. Would I be responsive if I was to write this grant focused on cisgender Black women?" And they said, "No, we really want you to focus on Black men who have sex with men, or other same gender loving men, or Black trans women." And I thought about that, and I said I could probably do that. But that would not quite excite me in the same way. Not that it's not important work that needs to be done, but that it doesn't excite me in the same way. And so I just, I have a really good colleague who does a lot of work with the transgender community. And I sent it over to her and I said, look at this. I think you'd be great for it. I'd love to partner with you on it. But it's just not for me to lead. And I wouldn't be competitive to lead anyway. But, I could have tried to go after it and get the money, but if it doesn't excite you, I would say, listen to that and, just find what it is that does excite you.
And just going off of what Courtney just said, yes, do things that are exciting to you, that motivates you, that, you know, it's a long process. And, you know, if you don't find it exciting, you're probably going to lose motivation. But what I also want to add is at this time, when you're in your undergraduate level, you know, try to find opportunities. Maybe it's not a direct path to what you're trying to do, but you know, getting skills right now, gaining skills to do maybe, you know, coding, or if there's an opportunity to do basic level, you know, transcription, whatever little thing, right, you can get experience on that builds your skill. Maybe you're learning, you know, your statistics 101, you know, whatever little thing, it kind of chips into eventually qualifying to do more, like, you know, the research that you're interested in. It just, you know, kind of building your blocks. So I would say at this point in time, talk to the people who do research. What are some of the things and skills that you need to develop? What are some of the, you know, areas that you're interested in? What are some of the things that people did as undergraduates, as, you know, early researchers, and try to kind of follow those steps, and nothing that you do is going to go to waste. That's what I think.
That's an excellent point.
Great. I think that that is a great note to end on. And so I just want to thank both of our presenters for this really fabulous discussion. You're very much appreciated, and thank you.